All right, so here's an example. All right. The United States is the only major country on earth not to guarantee health care to all people, okay? I live 60 miles away from Canada, Burlington, Vermont. You get heart surgery in Canada, you walk out of that hospital without owing a nickel, And the care in Canada is quite as good as in the United States. In our country, we spend almost twice as much per capita as do the people of any other country, including Canada. We have 80 million people who are uninsured or underinsured. We pay the highest prices in the world for prescription drugs. 30,000 people a year die because they don't get to the doctor when they should. Now, some of us are trying to fight for a Medicare for all. Nothing more radical than expanding a popular program developed in 1965 by Lyndon Baines Johnson and a Democratic Congress over a 4-year period to guarantee health care to every man, woman, and child in this country. And we are running into opposition from the pharmaceutical industry, from the insurance industry, from the private hospitals.
And from your own party.
And some in my own party, absolutely, who will spend together probably hundreds of millions of dollars to defeat us because they think the current system is great.
Let's specify they. Vice President Biden gave a speech this week. He said Medicare for all would tear up part of President Obama's legacy. Is he wrong?
Of course he's wrong. Look, you are looking at a United States senator who probably not only is on Health Education Labor Committee, which helped write the Affordable Care Act, but when Trump and his friends try to repeal it, you're looking at a guy who traveled all over this country, led large rallies, and worked with Democratic senators and members of Congress to oppose what Trump was doing. We ended up winning by 1 vote. The late John McCain came through. So, I have helped write and defended the Affordable Care Act. But you know what? Times change, and we have got to go further. We have to ask ourselves, why do we spend twice as much per person on health care as do the people of any other country? Is the function of health care to make huge profits for the drug companies and the insurance companies, or is it to provide quality care to all people? Let me give you an example of the dysfunctionality of the current system. I was just yesterday at Hahnemann Hospital in Philadelphia. You grew up in Philadelphia, you know the hospital. Here you have a major hospital in downtown Philadelphia, which primarily serves people of color and low-income people. It is a for-profit hospital owned by a real estate speculator who now wants to shut the hospital down to build condos, luxury condos, or big hotels. Does anybody in a million years think that is sane? So the function of healthcare in America is not to provide quality care to all. It is to make huge profits for the insurance companies, the drug companies.
Should the federal government run the hospitals in this country?
No, federal government doesn't have to run the hospitals. But the federal government should expand Medicare so that we have everybody in this country has a card which allows them to go to any doctor they want, any hospital they want, and which will end up costing us far less than the current dysfunctional system. The key question that we as a people have got to ask ourselves, do we think that we should continue a healthcare system designed to make huge profits for the insurance companies, drug companies, and others, or do we have a system which is universal, every man, woman, and child, that is in it and is run in a much more cost-effective way?
Says his words, your program would be too risky, that people would transition over to Medicare for all and they'd lose coverage.
I like Joe, and I hope we will have this debate, But when Joe says something to the effect that Medicare for seniors, what did he say, will end? I mean, that's just an obviously absurd situation. Let's think back for a moment. Let's think back. In 1965, LBJ and the Democratic Congress began Medicare. Today, Medicare is an extremely popular program, far more popular than any private health insurance program. They began that back in 1965 before we had anywhere near the kind of technology we have today. Started out of nowhere. And then people say somehow or another, with all the technology we have today, all the experience we have with running a Medicare program over the last 50 years, that somehow we can't, over a 4-year period, go from 65 which is eligibility right now, down to 55. Bob, do you know how many millions of people who are 60, 62 years of age would give, how do I say this, their left arm to get into a Medicare program? They're hanging in. They're waiting for Medicare. If we can lower that age from 65 to 55, down to 45, down to 35, and then cover everybody, this is exactly, I think, what the American people want.
So if that's what they want, if you're elected president of the United States, you're going to have to go to Capitol Hill and sell this. Vice President Biden said his plan would cost $750 billion over 10 years. If you're talking to a lawmaker, January 2021, and they say, Senator, give me a number, Medicare for all, an approximate number, how much would it cost?
Somewhere between 30 and 40 trillion over a 10-year period, which is much less expensive. Good, let's talk about cost. What the most serious economists tell us, that if we do nothing to fundamentally change the healthcare system, which is what Joe is talking about, keeping it as it is, we'll be spending something like $50 trillion over a 10-year period. I don't think there's a study out there, Bob, that does not suggest that Medicare for all is far less expensive than continuation of the current system.